Worldwide, cardiovascular disease affects the lives of hundreds of millions. Dedicated cardio nerds everywhere are working hard to fight this global epidemic. These are their stories.
Sir William Osler famously said that the good physician treats the disease, the great physician treats the patient who has the disease. On episode number 82, you met our patient, Jeremy Keck, a young man in his 30s with L-TGA and double inlet LV status post-Fontan procedure. But now, in this very special discussion, joined by his widowed wife, Ana Keck, we get to meet Jeremy Keck beyond his heart disease. As a son, brother, husband, father, successful businessman, skilled golfer, and so much more. As we cherish his legacy, we get a glimpse of his fortitude and optimism. His story is an example both of the triumph over adult congenital heart disease and the great need to do so much more. To honor his memory, we are joined by doctors Evelyn Song from Johns Hopkins, Pablo Sanchez from Stanford, and Michael Landzberg from Brigham and Women's Hospital, who will also take a moment to appreciate this powerful conversation with Ana at the end of the episode. Friends, remember, the Cardio Nerds are an independent platform with a goal to democratize cardiovascular education. The views expressed here do not necessarily reflect the opinions or policies of our employers. As always, this conversation is fully observant of HIPAA guidelines. If you believe in our mission, consider becoming a patron of the show on patreon.com. Before we get started, let's take a brief moment to honor and remember Jeremy Keck and so many others who've touched us, taught us, and continue to stay with us.
Welcome back, Cardio Nerds, and thanks for joining us for this truly special discussion. I am Evelyn Song, a third-year Hopkins resident, Cardio Nerds producer, and future women in cardiology. You all heard our very special CNCR adult congenital heart disease case from the Stanford Cardio Nerds. More than the case, it was a person's life story. Today, we get to learn about his life from his wife, Ana Keck. Joining us today are doctors Pablo Sanchez and Michael Landzberg. Pablo is currently a second-year cardiology fellow at Stanford. He's originally from Venezuela and completed his internal medicine training and chief year at Brigham. He's interested in cardiac critical care and interventional cardiology. He's also a great salsa dancer when he's not busy in the hospital taking care of patients.
Thanks, Evelyn. It's great to be back and a real honor to be part of this important discussion. Taking care of our patient had a deep impact on me, and I'm really looking forward to sharing that with our audience.
Thank you, Pablo. It also gives me great pleasure introducing our special guest today, Dr. Mike Landzberg. Dr. Landzberg is the immediate past director of the Boston Adult Congenital Heart and Pulmonary Hypertension Group at Brigham and Women's Hospital. He received his medical degree from Harvard Medical School, completed his internal medicine residency training at Columbia Presbyterian Medical Center, and then returned to Boston and did his cardiology fellowship training at the Brigham. Dr. Landzberg's research focuses on the management of congenital heart disease, and his clinical interests include pulmonary hypertension and ACHD. He's also double-boarded in palliative care.
Evelyn and hosts of Cardio Nerds, I want to thank you. Ana, I want to tell you my deep appreciation for allowing me to be here with you. I hope you all know that the greatest joys that any of us have as practitioners is being part of the lives of our patients and helping them to get to their goals and to their hopes. And I'm so looking forward, Ana, to learning so much more about Jeremy with you.
Dr. Landzberg is a truly outstanding and effective educator. For a topic as complex as congenital heart disease and patients who tend to have long medical histories that can definitely make their care daunting, he would always sit down with us and go through the physiology and what to expect during the hospitalization. I remember as a resident that we could always expect to see him wearing his signature suit jacket over his scrubs and extending out a fist bump at the end of the conversation. And this is all only seconded by his deep knowledge over his patients and his clear passion over their well-being and their care.
Probably you're making me smile. Thank you. Again, one of the hallmarks of each of us is that we tend to be pretty good mirrors, I think, and we reflect back the goodness and the specialties that we see in each other. And so that if you saw some goodness, I hope you realize it's in large part that of yourself. And
now I get the honor of introducing Ana Keck, who is our patient's wife and mother of their 2 children. I remember speaking to Ana early and throughout Jeremy's stay and recognizing that she was a tireless and wonderful advocate for Jeremy. She was very knowledgeable about his care in Arizona and was always ready with specific and important questions over his trajectory in the hospital. There is absolutely no question that caring for Jeremy would have been even more complex had it not been for the context that Ana and the rest of Jeremy's family provided for us.
Thank you. It's great to be here. And it's just such an honor that, we're able to do this and really give people an insight on not only his congenital heart condition, but who he was. And I just appreciate that, Pablo, you got to see the love that we had. And that you took a special interest in him and just the whole staff at Stanford, I appreciate everyone. I mean, I don't know if you know, but I would come in with donuts or like pizza for the staff during Jeremy's stay because I was just so appreciative of everything you guys were doing. And, even though he didn't end up, surviving, his heart condition. Without the staff at Stanford, I don't think we would have had those 8 weeks. And I'm so appreciative of everything you guys did.
No, thank you, Ana. You and Jeremy and the rest of the family were one of the most remarkable families and experiences that I've had throughout my entire medical career. Thank you so much for coming on and for allowing us a glimpse into his life and how much more than just a congenital heart condition he was.
Yeah, he was more than that.
So Jeremy was a 37-year-old male with double inlet left ventricle and levotransposition of the great arteries who had been palliated to a Fontan and presented to us after an out-of-hospital VF arrest. This was ultimately felt to be a combination of scar-based arrhythmia, electrolyte abnormalities, and potentially toxicities from sotalol and digoxin. Despite a challenging first few days, he made a truly remarkable recovery and ultimately had a subcutaneous ICD placed and he was discharged home. Another remarkable occurrence was that on the day that he was discharged home, my wife and I boarded a plane to Arizona and ran into Jeremy and Ana on that plane. Were it not for the fact that this happened in July during the pandemic, I would have tried to hug them both. It was a surreal culmination of seeing someone through what was likely their most challenging hospitalization and then embarking to return home. I've seen patients in and out of the hospital before, but I've never seen a patient and family like Jeremy and Ana. And it was just incredible that I got to see the totality of their care, bookended by then sharing a flight home back to Arizona.
Ana, thank you so much again from the bottom of my heart, representing cardio nurse community, the nation. Thank you so much for being with us and sharing with us your story, Jeremy's story, who he was as a person. We're all very honored to be able to be part of this story. And I did not get to meet Jeremy personally, but being involved in this episode and hearing about his case, I learned so much from him and from you guys. And I was wondering if you can tell us more about who he was as a person. What did he like to do? And how was he as a husband? I'd love to hear more about that.
I don't think that there's anybody, I've never met anybody more driven than Jeremy. He graduated with honors from ASU. And he was just super smart. I mean, and started in commercial construction. He wanted to actually go to Stanford and play golf there because he's an avid golfer, and he wanted to be like Tiger Woods. And I didn't know that he had written letters to the coach at Stanford until he had that stay at Stanford, and he told me, which was kind of like a neat thing to find out. But I mean, he was that good at golf, very driven, very competitive. Like I said, he started working in commercial construction, and he worked for a company for a while, but he made friends with a good family friend of ours. His name's Barry Chase, and Barry decided to make his own company and leave the company that they were at. And I just remember my husband telling me, as soon as Barry told me to shut the door of his office and said, I think I'm going to go on my own, my husband said, I'm in. Not knowing if he was going to be able to get health insurance, which is a pretty big deal for somebody with his heart condition. But he just knew, and he was driven, and that company has flourished into something that is just amazing. And it's Chase Building Team. And my husband told me that when the company first started, everybody brought their own laptops because, I mean, it was that new. You know, they didn't have company computers. And, you know, now it's a company that's pretty well known here in Arizona. And the culture that my husband and Barry created in that company was amazing. It's all about teamwork, and it's not just about and that was always very important for Jeremy. He definitely wanted to be inclusive and kind, and you know, there's not enough adjectives that I could say or nouns to express to you how kind and caring and he was, even in business. You know, if he could make it fair, he definitely, you know, would do it. You know, I mean, if you told him he couldn't get a contract, he'd laugh and say, well, now that you said I couldn't get it, now I'm going to get it. And he would. There's this neat thing at their office that they have that they bet each other. And if you lose, you have to give that person $1, but you have to sign it and say why you lost. And when I cleaned out his desk, I found $1,000 in ones. And it was signed. You know, it was like different contracts that somebody was like, I don't think we're going to get it. And they got it. And Jeremy would just always know, we're going to get it. We're going to get it. We're going to get it. You know, and that's just the type of person he was. It was an optimist. He was very positive, very driven golfer. He loved the Cubs, the Chicago Cubs. That was his team. I mean, when they won the World Series finally, it was like close to, you know, the birth of our children. He was that happy.
And I just was floored by something you just said. And I was thinking to myself, if there's anything that our audience across this country is going to take away, the statement that you just said, $1,000 in ones. To me, that symbolizes somebody who sees both the small picture and has the determination, the grit, and the drive of making dreams come true. And I think you captured that for all of us. We certainly had learned that medically as we heard the medical story about Jeremy. And I think you've given us so much more. Can I ask you, did Jeremy bring that back to the family? I'm saying it with a bit of a smile, and I worry a little bit about the answer. In terms of when you first met and got married, was there that same competitiveness?
We met at a restaurant here in Scottsdale, Old Town, and that drive showed up. Even then, I gave him my number, and I was just so busy trying to finish college and working 2 jobs, and I just wasn't able to go on dates when he was able to go, but he persevered. He kept on texting me, and I would and he brought it, the game. Like, he would be like, of course I had tickets to the Suns, and I would still say, hey, I can't go. And then I ended up sending a group text to everybody on Valentine's Day, and he texted me back and said, would you be my Valentine? So I was like, okay, I gotta go on a date with this guy now, like, that would be too mean. And we went on a date. We went to Fleming's, and we've been together ever since. So Valentine's Day was our first date. But he just brought that drive. We were together for 9 years, married for 6. We married in 2014, and we didn't have a big wedding. We actually just went down to the court and got married. But it was what we wanted, and it was a beautiful wedding to us. And then when we got done, we went to AJ's and got steaks and grilled them and stayed home. It was perfect for us.
I'm hearing both sharing with community, and I'm also hearing how deeply private and personal these important life cycle events were for both Jeremy and for you.
Yeah. He was an extremely patient and kind husband. He never yelled. And I know it's going to be hard for people to believe that, but he never yelled. And, when we had our first daughter, Emily, he said, his saying that he always says, we're making history, babe. We're making history. And he was so happy and proud. He didn't believe that I was in labor, so he didn't end up bringing his bag. And he sleep next to me, and he was cold, but he was just so proud and such a great dad. So patient with both our girls. Just loving and caring, and he loved to see them learn. That was his thing. He loved seeing them grow. It fascinated him when Emily started learning numbers, and because he's really good at math, he loved seeing our daughters learn and just get into those next steps. When I was pregnant with our second daughter, Kaylee, I had to have her premature 2 months. I ended up getting HELLP syndrome. I developed it, and it was really scary. My platelets dropped to 25, and I remember him being calm, even when they were rushing me into the OR for an emergency C-section, and when they were telling us, my diagnosis and how my platelets just kept on dropping, and my liver was not doing well, and my kidneys weren't doing well. And he would always just try to be calm, and I was scared. And he just was saying, it's going to be okay. You're going to be okay. And when I got discharged, he said, I knew you were going to get better. I just didn't know when. That was the frustrating part. I knew you were going to make it through this. I just didn't know when. And that's who he was. Even when something that scary was going on, he was calm and smart and took control and just pushed me to believe that I was going to be okay. And I think that has to do with his medical history. He just was always optimistic.
You clearly have a gift in your ability to convey to each one of us in the audience the soul of both yourself and of Jeremy and of your family. That's a real gift. I'm hearing Jeremy's gift as well. The statement about his calm, yet his insight, his intelligence. That doesn't come from nowhere, though. And you hinted in part it was from his medical background. Yet I suspect, we all have places that we go to. We all have something that gives us certain abilities. Sounds like there was not just a little bit of stress in your lives. There were times of intense stress, whether it was medical stress or life stress, new businesses. Where did Jeremy get these gifts? What allowed you and him to get through those periods of time?
I wouldn't say that was the most stress that we had, obviously, was when I can develop HELP syndrome. But, when it comes to business and things like that, it wasn't stress. Jeremy, he would climb a mountain and then be like, okay, where's the next one? So it wasn't, business was never stressful. He had that drive where he just loved it. There's people that wake up and hate going to work. Jeremy woke up and was ecstatic to go to work, because it wasn't just work. It was building a team and having this community, and he loved it. That was his drive. And, like I said, he never yelled. And I know it's really hard for people to believe, but he just never lost his cool. And, he would always just say, I would be mad at somebody or, stress about something. And he would say, it's cool. I got it. It's cool. And if the company didn't get a contract, let's say, he would say, okay, it's okay. Let's go. That's his license plate. Let's go. Next one. That's literally my husband's license plate. Let's go. Like that was him. There wasn't a lot of stress. I mean, I'm sure, like everybody else, there's some stress in your life, but he just was, like I said, so positive and just loved life and just viewed life differently, I think, than most people, because he realized that every day was a gift at an early age. So he made his life and my life a beautiful life. We had a beautiful life together. And, he came from a really good family unit. His parents were young when they had him and when he was diagnosed. My father-in-law, I think, was 23 and my mother-in-law was 20. And I admire them so much because having my children, I can't imagine, the stress given that, being given that diagnosis and being told that your son's going to have to go in for open heart surgery as a baby. And my mother-in-law just told me, we just did. We just didn't know where to go, but we just kept on pushing forward. She's pretty remarkable. I mean, both of them are. The way they just pushed forward and just kept on loving each other and trying to be there. Jeremy has a brother, trying to be there for their other son and still, being at hospitals and, going through all these surgeries. They definitely, I think that a lot of the love that Jeremy and the positivity that he gave out coming from such a loving family. There was a surgery, and I don't really know what year it was, but where he just was not breathing on his own, and that he was in the hospital, and his brother stayed with him, and they told him, you have to, you got to shake him when you see that he's not breathing. And so his brother slept in the bed with him, and every time he felt that Jeremy wasn't breathing, he would shake him all night. That's the type of bond they both had. They were each other's best friend. I mean, my brother-in-law spent his 21st birthday in the hospital with Jeremy playing video games. My mother-in-law told me that she learned all the parts of the heart because of Jeremy.
Ana, you are breaking every pre-existing thoughts of prejudice that people have. In-laws are not supposed to be as close and admiring of each other, and yet you're sharing with us how much you respect and you feel so close to Jeremy's parents and Jeremy's siblings and their depth of strength and sense of love and family and community. And what I heard you say about Jeremy, and the thing that resounds inside of me, was his ability to see the extraordinary in the ordinary of every day. Am I hearing that right?
Yes. You know, he would always say, you have a choice. You could wake up and make it a great day, or you could wake up and not make it a great day, but you have that choice. Even if I was upset at somebody and he said, so then you're going to give that person the power to make your day not great? That's silly. You go out there and you make it a great day. You know, I play tennis, and he's a golfer. I wouldn't win. I would, be like, I almost had it, but I didn't. And he would say, well, try harder. Why don't you practice more? How about let's go out and show swing. And why don't you look at videos on YouTube and then look at your swing in the mirror? That's what I do. Practice. Go out there and get it. You want it? Go out there and get it.
It's so easy for each of us as we hear the medical story that goes along with Jeremy's life and your life to think about the many holes that it were so easy to fall into and to find that were so deep, and yet each time that didn't appear, or it seems to not have appeared as a hole, but rather as a challenge, and a challenge that was short-lived, because then you get up and succeed. And on one hand, for Jeremy, that just seems to be his MO, his way of life. And it's a little hard sometimes to partner with somebody who just takes everything in stride and succeeds. How did that feel for you?
I've always told everybody that he drove me to be better. We were in our 20s when we met, obviously, and I was just like, oh my God, this guy is doing this company and doing all of this and that, and I'm still just trying to finish college, But being with him made me mature and really forced me to get a better drive, to try harder, to do better. I originally was just getting my undergrad, and then I just kept on seeing him just driving, and I said, I'm going to grad school. And I graduated with honors from grad school because of him. And I'm a youth and family therapist, and I had to take my test for my license. And I remember him, I was studying, and we already had our daughter, our 6-year-old. She wasn't 6 at the time. She was 1. And he was like, you gotta get it first time. Don't try for the second time. Get it this first time. And, it was just like that drive. And I went in there and I was like, oh my God, I gotta pass this test. And I did. And then I called him, and then he was like, yeah, I knew you were gonna do it. That's great. We'll talk about it at dinner. It was just like that. He pushed everybody to be as great as they could be in a positive way. It was not stressful. It was up, but I was so stressed about this test. And then he was just like, oh, you got it. Great. We'll talk about it at dinner.
It's clear how his optimism and drive painted how both of you went through your lives after you got together. How did he tell you about his heart condition? When did you learn about it? And what was going through your mind when you first learned about it?
So that's a really funny story. Not as funny as not funny, I guess. But we had just been dating for 4 months, and he had told me he had heart surgery, but he didn't explain to me how many surgeries or anything like that. So I wasn't really aware. And when I turned 25 on my birthday, he said, I had slept over his house, and he was like, my heart doesn't feel well. I have to go to the hospital, and I'm going to call my mom. And I said, okay, well, I'll go with you. Let me just take a shower. And, we got ready, and we got in the car, and we were on our way to PCH, which is the hospital that treated him most of his life. And when we were pulling into the parking lot, he was like, and by the way, I have a pacemaker, and they're probably going to defibrillate me. And I was like, 25-year-old girl, and I was like, what is happening? And that's how, we went in there, and then he finally explained to me what his heart condition was. And I still had to Google and try to figure out some of the things that he was saying, because I've never met anybody with a heart condition like that. But I loved him, and it didn't matter to me. And he told me one time when he had to go back in there to get cath, I slept with him at PCH. That was a fun experience because it's a kid's hospital, and showing up to visit my boyfriend who's 27. He got discharged, and then I picked him up and brought him home, and he said, why do you want to be with a guy that's sick? And I told him, I'd rather take a moment of something special than a lifetime of nothing special at all. And I said that to him all the time, because even though we didn't get a lifetime together, we got moments of the most special moments of my life. And I got 2 beautiful daughters. I mean, what else can you ask for? Obviously, I would have wanted more years, but he gave me my 2 beautiful daughters and a beautiful life for 9 years.
Ana, how are your children processing all of this?
Our 3-year-old, she knows he's not here anymore, but I don't think she really understands, death. My 6-year-old, she's doing well, considering, she is going to therapy. That was really important for me, but for the whole family, actually, to make sure that she was in therapy for grief. And she says that she knows that Daddy is an angel. And in fact, she'll say, hey, Daddy is here. I'm going to go give him a hug. And she'll hug herself. And says, I miss Daddy. But she is totally his daughter. She's so positive. She's like, but he's our angel. And he visits us at night. I bet he kisses us at night when we're sleeping, right, Mama? And I say, yes, of course. And she'll still say, good night, Daddy, every night when we go to bed. But she's still doing really well in school, and she's just like him. Of course, I'm like, I think it's him, she inherited that positivity and that drive, and I'm thankful. And we are a loving family, and I think that really helped. Before, when this incident at Stanford happened, I told her Daddy has a boo-boo in his heart, but I'll bring him back. I promise. And then when this last incident happened, she asked me, why does Daddy have to get so many boo-boos in his heart? And I said, I don't know, but I'll bring him back. And I guess that's the only thing that I regret saying, because I didn't really know the situation. I didn't know how long he had been out. And I just couldn't bring him back to her this time.
Wow, Ana, this is so powerful. It is clear that his drive was not only infectious to you and really made you all the more powerful and successful, but it's also clear that this went also into the upbringing of his children and how they saw the world and how they saw how sick he could get and how much better he could get at other points. And it's just amazing to see how such a complex context can be understood by people that are so young. And that's because both of you raised them so well and had them so well educated and gave them, just like he gave you, that infectious positivity and fortitude.
Yes, I'm very blessed. Like I said, I had 9 beautiful years with him, and he gave me my 2 beautiful children, and that's my prize in life, my kids. And he gave that to me.
Can I reflect? This is Mike for a second. We all hear how difficult it still feels in terms of expressing something to our children about uncertainty, and the whole life of saying that uncertainty doesn't exist. It's going to be one outcome. That's the way we see the world. It has to be that outcome. As I reflect, we are allowed to hope, and we are allowed to have a deep and rich hope that allows us to get to the next step. We're allowed to be wrong sometimes also. And as long as that hope still is there, it allows us to achieve. I marvel at what it must be like when you're facing uncertainty and you're facing real vulnerabilities, to be able to just keep going and keep pushing. I think for everybody who has heard across this country, who has heard Jeremy's story, and who hears you and the teamsmanship and the partnership that you two had as a family, it's so easy for us to get caught up and to trip into that hole of saying, my goodness, every one of those surgeries, every one of those defibrillations, every one of those, how could you possibly see the next day, greet the next day? And to hear how you mustered hope and how you continued with strengths, I must share with you, I don't know where that strength comes from.
I think part of it was him. I really do. I mean, he just always pushed forward. Like I said, when I was in the hospital, he was like, you're going to be okay. And I was like, I don't feel like I'm going to be okay. They keep on poking me every 5 minutes to take my blood, which it wasn't every 5 minutes, but and he was just like, you just push forward. You just push forward. And I think that when you're faced with something like this, you'd be surprised of like where you get the strength, because there's no choice. And when he had that incident and he was in Stanford and I couldn't get a flight until the next day, and my father-in-law went with me, and I got my nanny, and I was trying to get everything as together as I could for my kids. And I told his friends, I'm not coming back without my husband. I'm just not. That was not an option for me. And I think Pablo could tell you guys, like, I even when I left, I didn't want to leave. And Jeremy was like, you leave. And I just couldn't leave him. Just thinking about leaving, I knew that I had to fly back and be with the girls for a little bit. But when he was getting better and we were talking about him getting the defibrillator put in, he was like, you could leave and, come back. You have to go and be with the girls. But I couldn't. I couldn't leave him until I felt that he was okay. And I think that's what a marriage is. That's what you sign up for. It's a true partnership. And I knew what I was signing up for when I married him, with this heart condition. And I knew that I just couldn't leave him. He was the love of my life. He's the father of my kids. I was going to bring him home.
Ana, I can sense the very strong bond and love between you and Jeremy. And thank you so much for sharing all the stories you had with him. I can sense he was a great husband, amazing father, amazing brother, and a great son. And we are learning so much from him and from you. He was always there for you, just like you were always there for him. I am a resident and I hope to become a cardiologist one day. And as a future cardiologist, I was wondering if you have any tips, suggestions for me and for future other fellows in training and future cardiologists. What would you want us to know about taking care of people with ACHD like Jeremy? And do you have any suggestions for how you would want doctors to share, medical information with you and family?
I think, the only thing that I could say is they're more than their heart condition. So talk to them like they're more than their heart condition. Don't just walk in and out and give them the diagnosis and tell them what the treatment's going to be. It takes a minute to make somebody, or maybe 5 minutes to make somebody feel like a human again when they're in the hospital. And you could just ask them, like, what's your favorite thing? Or, to not just treat them as their diagnosis or as a patient, but to treat them as a person. I think that's really important. We were very lucky in the fact that the cardiologist who treated him for most of his life, Dr. Jadakian, at PCH, he had that bond with Jeremy. There was a time where Jeremy had a surgery and it was, it wasn't good. And they were scared that he was going to crash. So Dr. Jadakian slept in the room next to him. Didn't go home. Didn't go home because he wanted to make sure that his boy was going to be okay.
Wow, that's amazing. Thank you so much for the advice. And I completely 100% agree with you. We should treat all of our patients as humans. Everyone is different. And I'm very happy to hear that Jeremy had great doctors taking care of him throughout his life.
He really did. Dr. Jadakian became family. He called Jeremy's son.
Wow.
Ana, us in the medical field get very good at coming up with a treatment plan for a patient, and that often includes multiple different appointments, multiple medications, in a way that can be very confusing and challenging for both the patient and the family to understand. And just like putting into context who a patient is outside of the medical condition, understanding how challenging it can be for all these things to fall into place correctly also seems important. How did you manage to keep everything straight and make all the appointments, procedures, medications, and everything that he needed to have in order to stay healthy?
A lot of the credit has to go to my mother-in-law. She's the one that knows her baby, right? So she really makes sure that, obviously, she took care of all his appointments and everything when he was little. But even as he got older, she really made sure that he went in for his INRs and, make sure that he got his medication. But Jeremy was very responsible for all his medical appointments. And I think part of that was also him trying to shelter me from how much medical involvement there really was. He would always just say, like, oh, I have this appointment or that appointment. It's not a big deal. Or sometimes he would, have appointments and I wouldn't even know. His medication, we had it in a Mediset, and he set his own Mediset up, and he knew that he had to take it. I think that when you have, a heart condition like he did, you could either let it drag you down, or you could let it bring something else inside of you. And that's what he did. It didn't define him. And he went to the doctor's appointments, and then he would still go back to work. When he got back from Stanford, 2 weeks later, he was like, I got to go to work. And he was like already trying to go golf. And I was like, you can't do that. And he was like, fine, I'll just go try to hit some balls. That's just who he was. He wasn't going to slow down. He was going to live his life.
I remember talking to Jeremy as we were deciding what case to share with the audience for this podcast. And I also remember him being very excited for us to tell his story, not just because it is interesting and there's a lot of learning to be had over everything that he's gone through, but he mentioned that he wanted future doctors and cardiologists to learn from his experience. Genuinely, he seemed very excited to hear what the podcast was going to sound like. Can you tell us more about how he felt about this project?
Yes, I think he was very excited, like I said, because he didn't let it define him. Like if he didn't like people knowing that he had a heart condition. He wanted people to meet him and know him for him. And then if the subject came up, he might bring it up. And I think that this is exciting for him because he just wanted people to see, what you could accomplish. It doesn't matter. The sky's the limit. And it doesn't matter if you have a heart condition. Live life to the fullest. And I think that he was just excited to share his story with people because he wanted maybe other people that might be younger than him or parents that have children, that are being diagnosed with a condition or a similar heart condition to him, and them to hear this and know that, you could still have a beautiful life. Your child could still, your child's going to strive, your child's going to be okay. Went to an event at Phoenix Children's Hospital, and remember, there was a lady there and her daughter had this condition that Jeremy did, and her daughter couldn't have been more than 4 or 5. And she shared her story, and, Jeremy, we waited a while, and I was like, I don't know why we're waiting, but, he took the woman aside and talked to her and said, hey, listen, I'm 36 and look at my life, and this is my wife, and your daughter's going to be okay. This is a great hospital. These are great doctors. Your daughter's going to be okay. And I think that he was excited for this podcast because he wants people to know that, you could do so much even though you're diagnosed with something like this. Like you said, it's scary to go into the unknown. And his heart condition, even though we knew about it, it's an unknown thing, right? We don't know if he's going to wake up and the pacemaker's not going to be right, or the medication is going to stop working. But I think he was, like I said, he was just excited to show people this heart condition, but you could still strive. And I think also, we are very, very pro-education. I don't know if that makes any sense, but I think he just wanted people to learn from him too, because maybe this next generation of cardiologists that are listening to this podcast are going to be the ones that find something to help people with his diagnosis live past 40. That's what we're really hoping for. And I mean, we keep on thinking, about his legacy, and we are really excited to start scholarship for future cardiologists, at Stanford. And I don't really, we're just getting our feet wet with that. And we're going to do a golf tournament out here, and the proceeds will go to that. And I think, my mother-in-law and I talked about it, and it just felt right, I think that that's something that he would like to help other people with his heart condition, like to make sure that we get some other Dr. Jadakins out there, future Dr. Jadakins. That's exciting for us.
Wow, Ana, that is amazing. We will post specifics about this tournament and fundraising on the blog and the website.
Thank you. There's a GoFund for Jeremy Keck Legacy Fund. That's as far as, we're already planning the golf tournament, but as far as fundraising, that's where we're at.
Well, I'm already there, Ana, I have to tell you. And I want to express to you that no one of us listening or present on this discussion today can feel the amount of pain and of loss that you have and that you have experienced. I also want to tell you that even in sight of all of that, you've managed to share with us even more so the joy, the meaning, the drive, the sense of family and determination, and the fact that heart disease in no way, shape, or form defined Jeremy. That everything else, family, sport, golf, love, children, that's Jeremy. And I have heard few people over decades be able to reflect back so clearly to us. I want to thank you. You've allowed me in this short period of time to become one of your family. I don't know how you did it. You did. And I feel as if I can feel Jeremy. and I take away from him, I'm going to start collecting $1 bills, Ana. I'm going to tell you the truth. And you've made a change in my life, and Jeremy has made a change in my life. I am so appreciative for you allowing me to be with you today.
Thank you. I'm honored that you guys are doing this, and I'm so grateful to be a part of this as well.
Yeah, Ana, echoing what Mike was saying, Jeremy, just him wanting to be on the show, I was not surprised to hear that at all. Is that just so consistent with who he was as a person? And, before we conclude this episode, I was wondering if you have any final message for the rest of Cardio Nerds Nation out here.
I guess, going back to what I said to you, they're not just a heart condition, and I know that, you create treatment plans and it goes, and you have to go from room to room, but, take a minute. You'll be surprised. You'll be surprised of what that will do for your patient. And also I feel like you'd be surprised. You might become a huge part of that person's life. Going back to Dr. Jadakin, he's a huge part of our life. And, even now he checks in with my mother-in-law and checks in with me. And, talking to him, even after Jeremy passed away, it gave me some peace because he said, Jeremy was very realistic about his condition. And I think, like I said to you guys, he sheltered me a lot. And I was so grateful that he had that relationship with his doctor. Because if he, felt like he couldn't tell me something, the fact that he could tell his doctor, hey, this is how I'm feeling. And really, it couldn't have been more perfect, right? He was realistic and really honest with the person that he should be with, his cardiologist. And, that bond doesn't come around a lot, and if anything, that I would future cardiologists or cardiologists that are listening to this is, take that,
Yeah, I'm so happy to hear of all the strong bonds you, Jeremy, and everyone have formed with doctors and other friends. And, these bonds will be for lifetime. So thank you all so much for this wonderful discussion. Your time is also important and precious, and this was just so phenomenal, educational, and inspiring. Ana, thank you for being so generous with your story and sharing so much with us about the life, the love, positivity, and the legacy that Jeremy left with us. And as a young doctor, I learned about what it means to care for patients with ACHD and their families. As a human, I learned even more about the things that matter most to our patients and who they are outside the hospital. Knowing our patients as people, as parents, children, siblings, even golf enthusiasts, help us really keep their values at the center of our approach and our medical care. As an Osler resident, quoting the famous William Osler, he once said, "The good physician treats the disease. The great physician treats the patient who has the disease." And Pablo, I think that's exactly how you took care of Jeremy when I say this. And from your conversation with Ana and from being involved in this case, Jeremy and Ana, everyone got great care at Stanford. And you really got to know Jeremy and Ana, not just as a patient, but as a human and as someone with hobbies and life outside of the hospital. And Mike, thank you so much for helping us learn how to treat patients with ACHD and how to really help them kind of navigate through what may be the most difficult part of their lives. And Ana, again, thank you for sharing Jeremy's legacy with us today. As he would have said, we are making history. Thank you, everyone. Again, thank you for your time.
Thank you.
Pablo and Evelyn, I'm just stunned. An interview and a discussion that I had hoped to be part of and didn't know exactly how it was going to go. Can I ask you, what are your thoughts? How do you think things went?
Yeah, I was very touched by all the stories Ana shared. Just like you, Dr. Landzberg, I did not know what to expect before the recording, and this was more than it exceeded my expectation. I learned so much about Jeremy. I never met him. I did not get the chance to take care of him, but I felt like I really learned who he was as a person, really learned what valued most for him. And as a future cardiologist, a future fellow in training, this was such a very educational opportunity for me that I'm just so honored to have the opportunity to be part of this.
Same. As we went through the medical portion of his hospital course, something that you have to read in between the lines is the story behind the patient and the family before they got to the hospital and what they're thinking, feeling, and going through while they're there and afterwards. And the reason that we wanted to do this session was so that we could color into the multidimensional picture that is treating the patient as a whole. That it's more than the sotalol and the digoxin and the VF, is everything that is happening in between those lines. And so having this session where we could really delve into what Ana and Jeremy and the rest of the family had gone through before getting there, and then how she felt within it, and then afterwards, was, I think, just as important as hearing the case itself, if not even more important.
Pablo, as you were speaking, it brought to mind a couple of things. We've worked together for some time when you were back in Boston, and you know that for about 25 of my 30-some-odd years in practice, I was an interventional cardiologist. And I will tell you, I was plagued by the uncertainty of what it was that helped my patients and their families get better. Was it the opening up of some narrowing, closing some hole, understanding hemodynamics? Was it the pharmacotherapy that I was using? Or in fact, was it something about understanding the patient, understanding their hopes and their goals, and trying to align what we in medicine had to offer with what that person is and what their aspirations and what they found would be intolerable? And that was always the balance, and I continue to struggle with that. And as I thought about that during the interview, I also thought to myself, as I listened to you, Pablo and Evelyn, as I listened to you, I kept thinking to myself, wow, it's not just our pharmacotherapy. And by the way, Pablo, I'm not trying to derogate what Stanford did, and what you all did was amazing, because I had not expected the outcome from that hospitalization that you were able to achieve. But it was so much more than that. I'm thinking during our interview with Ana, how powerful the tools of our words are. Right? We send out a ping of some sort, and we hope to get a particular response. And it's not just random, right? We're not just voyeurs in the lives of our patients. Every word, every question that we have is an important tool. It's therapeutic when we want it to be therapeutic. It's exploratory when we want it to be. I was so impressed at how much the two of you thought through what this interaction was going to be like, helped to learn about Jeremy, but you were also so therapeutic with Ana.
Yeah, no, that was the objective, is to provide Ana with the space to color in with the things that we didn't necessarily have time or were able to get into while they were in the hospital. I mean, all those important niches of information that can end up passing by if you don't pay close attention. And it was amazing to hear her tell us a story about how they met, how she slowly found out what his condition was like, and how his positivity, determination, and optimism colored the way that she was as a person after they met, and how that ended up going down even to their children, who are still learning to cope with his loss. I think it makes the experience of treating him all the more important and remarkable because we get to learn of what they all went through.
I think that the two of you really very much unpacked the suffering, the multifold nature of that. There's the physical component of it, and there's so much more. And you kept yourselves open during the conversation. The toughest part of any conversation that we have with patients is that we always do, we have a preconceived notion of where we're heading. And it's the tough part of saying, hold yourself back, listen, be in the very moment. And when you do that, you hear what you wouldn't have heard otherwise. And I heard the two of you do that so much. I tried to do that as well during the interview. It's a practiced art, and it so frequently gives us those small little cues and clues as to what can make the difference. I saw the two of you pivot during our interview from what it appeared to be a particular kind of question, and then when you listened and heard Ana, you were able to reflect immediately and to change those questions. I want to tell you that is mature beyond maturity, and it's taken me decades to learn and practice, and I'm awed by the two of you in terms of doing that. It made for a really deep and meaningful approach to care. Evelyn, can I reflect? You were talking about the great William Osler.
Yeah.
There's also that quote about, it's not just about the care that we do, but it's the caring. And that was very clear. As we take care of patients, we take care of their entire world, don't we? And we take care of their families, their loved ones, and the partnerships that they have that give them support. It's so important in terms of their legacy and who they are and their narrative. And I heard how deeply the two of you were committed to that.
Yeah, I completely agree with that. And while I was listening to Ana's story, Jeremy's story, I remembered when I was an intern and my chief, which was Ahmed, always wanted us to include a hobby in the patient's one-liner. And I continued doing that even throughout my residency. So all the patients I take care of, I learn more about them as a human, as a person, rather than just someone with XYZ disease. And I think that's just so important for us to be a good doctor. We, not just clinically well-trained, but also really learn our patients as who they are and learn about their family. So I really want to thank you, Dr. Landzberg, for this great conversation. I learned so much, and Pablo for sharing this great case with us and with the rest of the Cardio Nurse Nation.
Dr. Song, Evelyn, thank you. Dr. Sanchez, Pablo, thank you. If that's the right way to say it, I am a cardio nerd. Thank you so much for allowing me to be part of this with you.
Thank you.